Welcome to the Department of Pathology and Laboratory Medicine at Boston Medical Center and Boston University School of Medicine. My name is Dr. Chris Andre, and I am the Chair and Chief of the department. I've had the pleasure and honor of working here since 1982, and I'm delighted to share some of our rich history and thoughts about the department, our institution, and our program. The organizations that we know today evolved from a number of original institutions: the Boston City Hospital, chartered in 1864, and Boston University Medical Center Hospital, which was founded in 1855 as the Massachusetts Homeopathic Hospital. In July 1996, University Hospital and Boston City Hospital were merged into the Boston Medical Center, a not-for-profit institution that fully retains the missions and commitments of its predecessor institutions. The Boston University School of Medicine was established in 1873, when the university assumed responsibility for the New England Female Medical College. Among its historic distinctions are its commitment to equal education for women and men, and the graduation of the first female black physician in the U.S., Dr. Rebecca Lee Crumpler. The overarching missions of the present-day hospital and medical school, as well as those of the predecessor institutions, were to care for an underserved patient population predominantly living in adjacent neighborhoods by providing exceptional care without exception. The pathology department came into being at the Boston City Hospital's inception. Pathology was emerging as a defined field of medicine and basic science, with Boston as one of the leading cities in the nation to recognize the importance of the discipline. It was Dr. Mallory, appointed in 1891 by the then Chief of Pathology, Dr. Councilman, who defined the work, science, and art of pathology and histopathology, as well as organizing his department along the lines of a professional training school. More than 120 graduates came out of his program over the course of his long career, and it is upon the shoulders of these giants that our pathology residency training program has evolved. Along with our history, I want to share the foundational values of the Department of Pathology and Laboratory Medicine at Boston Medical Center and Boston University School of Medicine. We strongly believe that the cultural and social diversity of our faculty, staff, residents, and students is vitally important to the distinction and excellence of our clinical, research, and academic programs. As a department and institution, we embrace and champion justice, equity, diversity, and inclusion. And while our organization has a rich history of inclusion and diversity, we recognize that there is much work to be done to create a fair and just society. And we are committed to the active pursuit of equity, education about social determinants of health, anti-racism, and educational opportunities for all people. We aim to create an excellent learning environment for our trainees. We strive to create great opportunities to gain knowledge and experience in all aspects of pathology and laboratory medicine. Additionally, we want to create an environment where residents have opportunities to pursue research interests that will help develop their career and to participate in medical and graduate school education and teaching. Our team, made up of attending pathologists, residents, scientists, managers, support staff, and students, are all committed to your success. We hope to welcome you to our department and for you to become a part of our rich history and our current and future experiences.
Hello and welcome to our laboratory. My name is Charlene Mack, and I'm the Associate Operations Director of our laboratory here at Boston Medical Center Lab. Our pathology lab is led by Dr. Grace Zhao, who is our medical director and chief. She's also the vice chair of the anatomic pathology lab. We're so proud to have you here today.
Our surgical pathology gross-in room staff is made up of 6 residents and 3 trained pathologist assistant, and we also have 1 certified per diem pathologist assistant who is very experienced. The department uses CoPath as our lab system, and in CoPath we have advanced barcoding and tracking, which is a scanning system that allows us to track specimens, blocks, and slide throughout the system. Our histology lab and our special procedures laboratory uses automated immunostainers and H&E stainers. We have a really nice histology group. They're really experienced staff. Our next lab is the Electron Microscopy Laboratory, and we also in this lab have the renal services run by Dr. Joel Henderson, and they're responsible for high resolution images of biological and non-biological specimens. Our molecular pathology lab is made up of molecular diagnostic and the molecular genetics lab. We also have in another location our hemoglobin diagnostic lab and our amyloid testing lab. Of note, our amyloid testing lab and our hemoglobin diagnostic labs are reference lab for the United States. Labs throughout the U.S. send us specimens to these two reference labs, so we're really proud about that. Our Cytology Laboratory is run by Dr. Sandra Serta, and here we do GYN samples, non-GYN samples, as well as fine needle aspiration, and we utilize the SurePath platform for our GYN samples. You have a choice of SurePath and ThinPrep, and we utilize the SurePath. We also have a frozen section room for rapid interoperative consultation, and that's located in the main part of the hospital, as well as our decedent affairs service, where we have our morgue in the main part of the hospital. We have roughly about 60 to 70 surgical autopsy specimens per year.
Finally, our laboratory is accredited by the College of the American Pathologists, otherwise known as CAP, which is the leading organization of board certified pathologists who are advocating for excellence in patient care of pathology and laboratory medicine worldwide.
Welcome to a video tour of the Boston Medical Center Department of Clinical Laboratory Services. We have a full-service 24/7 laboratory that's led by Dr. Nancy Miller, the Chief Medical Director of the Clinical Laboratory, and has cutting-edge technology and incredibly dedicated laboratorians that strive to stay on top of the latest and greatest technology so that we can give excellent patient care to every patient. Our patient population is usually the underserved. We have refugee clinics, we service many homeless, we are very involved with the opioid epidemic, and we are located next to the Boston Healthcare for the Homeless. This makes BMC Clinical Laboratory a very exciting place to learn and work. The Clinical Laboratory Department consists of many smaller departments. There's the Chemistry Laboratory, which includes toxicology, serology, and autoimmune testing. There's the Hematology, Coagulation, Urinalysis, and Flow Cytometry Department. The Blood Bank, which also has a stem cell and tissue banking area. And then there's Microbiology, including AFB testing and fungal testing. There's also Molecular Microbiology for infectious disease testing. Everything begins with phlebotomy though. Phlebotomy services that the specimens then come to the central receiving area. We are taking a tour through the central receiving area where most of the specimens are sent via pneumatic tube system and received in the lab and then sent to the appropriate department. This is where the Abbott Track Accelerator A3600 begins. The Abbott Track was one of the first in the United States and was implemented last December. The new Abbott Track centrifuges and routes specimens to many automated chemistry analyzers. This allows for optimum turnaround times and precision testing. After the testing is performed, the Abbott Track then sends the specimens to a storage unit to be stored refrigerated for several days. If additional testing is required, the samples are retrieved electronically and then forwarded for testing. Aside to the automated testing, special chemistry is performed for gel protein electrophoresis and anti-nuclear antibody testing. The chemistry laboratory is led by Dr. Yachana Kataria and managed by Graziella Haddad. Dr. Julie Lee currently is the medical director of the hematology department, where there is another automated track which automates cell counts and CBC testing. This is the new Sysmex track that was implemented 4 months ago. It is also state-of-the-art automation with digital cell imaging. There is the TOPS IL system that performs coag testing, and the urinalysis department utilizes the IRIS instrument. Dr. Nancy Miller currently is also the medical director for the Microbiology and Infectious Disease Molecular Microbiology Department. The micro department continues to use old school technology mixed with cutting-edge instrumentation. The micro lab continues to perform bacterial cultures, TB cultures, fungal cultures using standard and molecular techniques to accelerate identifications and bacterial susceptibilities. There is the bioMérieux Vitek MS, uses MALDI-TOF technology, and the BioFire Torch, which does our blood culture pathogen identifications, meningitis, encephalitis panels, gastrointestinal panels, and respiratory panels, including SARS-CoV-2 testing. The infectious disease molecular department tests for a wide range of STD pathogens utilizing the Roche 6800 and 4800 and the Hologic Panther plus the Abbott M2000 instruments. Viral load testing for HIV, HCV, and HBV plus HCV genotyping is performed in this department. The infectious disease molecular department is also very involved in the COVID-19 testing, which is now performed on 7 different platforms. The blood bank department is led by Dr. Reggie Thomason and is managed by James Karen. This coming year, there will be installation of a new irradiator and the possibility of a CART program. This department also contains a tissue dispensary and a stem cell repository. BMC emergency room is a level 1 trauma center, and this keeps our blood bank hopping. We see many traumas due to our location in the middle of Boston. Our blood bank was involved in the saving of many lives during the Boston Marathon bombing. To help increase the accessibility of blood to trauma patients, we installed a remote blood dispensing machine, the HemoBank, within the emergency department. What I'm trying to say is that BMC has the patient population, the incredible physicians that love to teach, and the state-of-the-art equipment to see, learn, and do everything you need to know in the clinical laboratory. We are varied and intense in our laboratory testing. You will not see this at the majority of other hospital clinical laboratories.